Hi, my name is Arkady Yadgraf, and I'd like to demonstrate the surgical procedure for iDose implantation. The case starts with a clear corneal incision varying between 1.5 millimeters to 2.4 millimeters. In this case, I use a side port to create about a 1.5 millimeter incision. Using a cohesive viscoelastic, we form the anterior chamber, as you would for most MIGS cases. Once the head and microscope are turned, the iDose is introduced through the wound, and usually I like to wiggle it through the wound if it's a little tight because it does have a pointy tip. And using a gonio prism, this part really is the most important part of the entire procedure, and that's good visualization of the tip of your iDose as well as the trabecular meshwork. Specifically, at the tip of the iDose is a tiny pointed barb, and that's what you're going to want to drive through the trabecular meshwork and into the back wall of Schlemm's canal, seeding it into the sclera. You can see here that there's a little bit of pressure and then some more as you see it going out of focus, and that's important. The more you push, the better it anchors. And then lastly, the last major step here is to confirm that it's anchored well. And I do that by tapping on it and making sure that it's not dislodging or moving out of position. Lastly, after moving the eye back to primary position, we're going to irrigate out the cohesive viscoelastic and also visualize the iDose to make sure that it's not mobile or moving around. And you can see here that it's nice and firm against the angle and not tilting or moving. The wound is hydrated and the eye is confirmed to be at physiologic pressures. And that is the iDose implantation procedure. Thank you for watching.